Hi there, this is Sandra with another XDR Clinical Minute, and this is part 2 of our series on the XDR holder kit. I have here 2 anterior bite blocks, and the way you can tell the difference between the size 1 and the size 2 is that the size 1 is a little smaller and black, and the size 2 is a little larger and white. But today we're just going to be working with the size 1 anterior holder because that is the one that we do recommend for anterior shots. It's just easier to get it into the mouth on adults. You don't only use the size 1 for pedo patients. You can use it for adults who have small mouths, a lot of tori, people with narrow palates or gaggers. And it just helps you get a better paralleling technique to capture that image that you want. And it'll save your staff a lot of time and energy. So to put the holder together, what you do is you take your bite block, and this will work the same way with the size 2. But you take your bite block and your sensor, and of course you're going to have a barrier on your sensor for infection control. And you're going to snap the sensor in. You don't want to slide it in because then you'll end up tearing your barrier there. So we just snap one side in, snap the other side in. And then you'll notice when you do that, sometimes you'll have a little gap between the sensor and the bite piece. So you want to make sure your sensor is positioned all the way down into the bite piece there, so you can make sure to get the incisal edges of the teeth into your image. Now, if you're using the paralleling guide system, you're going to use the aiming rod that says the word anterior on it. And you're going to take the little pegs on the rod and you're going to place them into the holes on the bite block. Then you're going to take your ring, and like I mentioned in the first video, the ring is labeled also. One end, it says BW/ANT, so you just find that end and you position that end for your anterior holder there. You have a little clip here for your cable, so you can push that in there to help keep your cable out of the way. And when you're positioning in the mouth, you just kind of position your cable off to the side. And as long as you see the sensor centered within the ring, then you know that your holder is put together for your anterior shots. Now, I have a mandible here that demonstrates why we recommend using a size 1 sensor for your anterior shots. Remember that the size 2 sensor doesn't bend like film does. So using a size 1 just makes it a lot easier to position that sensor into the patient's mouth. And it helps you get a lot better of a paralleling technique. And this position will be the same for your upper anteriors and lower anteriors. Now, to use the H-stick system, you can use the same bite blocks. We'll just take this rod off of here. And every now and then, make sure that gap is not there. So you want to push your sensor down like so. And if you want to use the H-stick system like a snap array, you're going to use the H1 stick. That's the longer stick here. And you're going to take either end will work. And you can take the pegs on either end here and you're going to position it into the bite block like this. And then you can use it without a ring, and you can use it for your upper anteriors, flip it over and you can use it for your lower anteriors. But if you do want to use a ring, that's what this other thin rod is for. You're going to take the rod and place it into the little hole there. Then you take your ring and you position it until you can see the sensor centered within the ring. You do have a little clip here for your cable as well. And as long as you can see the sensor centered within the ring, then you're good to go to take your anterior shots. And again, this is for your upper anteriors. You flip it over, and this would be for your lower anteriors. Now, if you wanted to take a full FMX with your H-stick system, you can take the rod and ring off of this one, take the bite block off, and you're going to use the H2 stick. Now, the H2 stick is also labeled. You have one end that has BW on one end and then PA on the other end. And we want to use the PA end because we want to take an anterior PA. So we take the pegs on this end, on the PA end, and we place it into the holes on the bite block. And again, you can use it just like this without a ring for upper and lower. Or you can use it with a ring. So you would take the rod here and you place it in the little hole there, and then you're going to take your ring and position it again until you can see that the sensor is centered within the ring. And you can place your cable into your little clip here and that is what it will look like for an anterior holder setup with your H2 stick. And this is for your upper, and this is for the lower anterior. So for more information on the XDR holders, please feel free to call the XDR phone number and ask for a clinician. They'll be happy to walk you through this again and to answer any questions you may have. Thank you for watching part 2 of this series on the XDR holder kits, and we'll see you in part 3.